Good evening, everybody, and thank you so much for joining us. My name is Bryony, and I am from MQ Mental Health Research, and I am delighted to be joined today by Lea Milligan, the CEO of MQ. Hello, Lee.
Hi, Bryony. Hi, everybody. How are you all?
We're all good, thank you. How are you?
Yeah, not too bad. Enjoying day one of work from home, if you can, once again.
Yeah, back again.
There was a Christmas-based film called Groundhog Day that this reminds me of, but hey, we'll move on.
So this evening's webinar is an exclusive event for our MQ Momentous givers, who are our most valued supporters. We couldn't do what we do. We couldn't invest in research without the generosity of supporters like you. So we wanted to give you the chance to ask any questions that you might have. So please submit any questions that you have for Lee in the Q&A box below, and we'll come to them shortly. We did have some people contact us to say that unfortunately they couldn't make it this evening, but who sent through some questions anyway, so we'll be getting to those in due course, and a recording of this webinar is going to be made available after this evening as well. But Lee, before we start with the questions, why don't you talk us through some of the year so far?
Yeah, brilliant. Thank you, Bryony, and thank you so much everyone for joining us. As Bryony said, MQ is the largest charity in the UK focused specifically on mental health research, and we are entirely funded by the generosity of people just like you who care about mental health, who realise that research is part of the answer. And so in one sense, you know, I'm speaking today, if you like, to the converted towards the mental health research agenda. But let me just underscore why this is so important by asking a couple of questions. Why can't you sleep at night? How do you help your colleagues through a pandemic? How do you stop a friend trying to take their life again? Those three questions have just one thing in common. They are far too important for us to take a guess at them. And at MQ, we believe that without research, it's just guesswork. And for far too long, mental health has been guesswork. We've had an understanding of IQ for years and years. In the last decade, we've got this concept of EQ, emotional intelligence, if you like. And I believe that now is the time for MQ, for us to increase our mental health intelligence. So to that note, what did we learn in 2021 about mental health through the research that MQ has been delivering, funded by people just like you? One fantastic project, I'll share two or three. One fantastic project is the Idea Flame project, which was a project specifically focused on looking at depression in children and young people. And this unique global project that spanned 5 continents was designed to develop a tool to predict which children were at most risk of developing depression based on risk factors in their locality, in their country. And in 2021, that project came to conclusion with a bona fide prediction tool to do exactly that, which has the potential ultimately to change the lives of millions of people, being able to predict early onset depression in adolescence. And we know that 75% of all mental health conditions are diagnosed in children and young people. So this really is a groundbreaking moment in our understanding of detection. And so MQ has committed a further £300,000 to the Idea Flame project, along with other funders who also now want to understand how this tool can be rolled out. And specifically, we're also investing in looking at the link between inflammation and depression. There's already good research out there to show there's a link between the two, but this will be the first time, because of this prediction tool, we can look at the onset of inflammation and depression and see what that link looks like and how we can make an impact into that. So a hugely exciting project that we've learned from, invested more into, and moved on with. Another really exciting project that is drawing to conclusion this year is one on PTSD. So we funded Dr. Jennifer Wild, who you can see in the corner there, to look at a new treatment for PTSD in healthcare staff. Originally, she was looking specifically at paramedics in the healthcare system, but when COVID struck, we helped to support funding to pivot that to all healthcare workers, recognizing the wave of deaths that was hitting the NHS and ultimately the PTSD that then was impacting staff. And the initial findings that came out just about 8 weeks ago are hugely exciting, showing a treatment that has a 90% recovery rate from PTSD. Now that is a huge level of efficiency and effectiveness. And what's even more exciting is there's promise that there is the research can then go on to develop ways to prevent full-blown PTSD from developing. So a study that started only 2.5 years ago already have an impact in the lives of individuals, and that is a short turnaround for research. So a really exciting project by Dr. Wild. We've also, obviously, I've got to use the C word, I apologize. We've obviously been focused on COVID this year as well. And we partnered with the FOSP COVID study, which stands for Post-Hospitalization COVID study, which has looked at around 2,000 patients across the UK who've been hospitalized because of COVID, and trying to work out what recovery looks like from that. So looking at long COVID or post-COVID syndrome, if you like, and the 5-month indicators are already out. So what we know from the study is that 25% of patients have symptoms of depression and anxiety, that a little over 10% have symptoms of PTSD, normally linked to ventilation. 17%, nearly 1/5 of everyone who was surveyed has cognitive impairment, or to we lay individuals, brain fog. And further to that, 71% have not fully recovered at 5 months. So let's take a beat on that for a second. That means that well over 2/3 of people who are hospitalized haven't recovered after 5 months. And nearly 1 in 5 people is suffering from this brain fog element. And this is a hugely worrying thing, because brain fog is something that in research terms we know very little about. So there's a real area of more investment that needs to happen there. And MQ is really interested in trying to work out how we can invest into understanding brain fog, both in long COVID or post-COVID syndrome, and also how this can impact our understanding of brain fog in other conditions like dementia and other places. So this study will continue for the next 8 months, and the 12-month results, so 1 year on from hospitalization results, come out at the end of this week. So keep an eye on the MQ website for those. So that's just a smattering, 3 studies of our entire portfolio of research that we've seen results from this year. So what new research is MQ investing in? Because if we want to solve this crisis of mental ill health that we're in the middle of and have been long before COVID, we've got to keep investing today. So let's talk about some of the new research we've invested into. At the start of this year, we launched our new research plan with 3 thematic focus. One, which is the focus for this year, thriving in a post-pandemic world. And what we really wanted to understand there specifically was the impact on children and young people, on workplace mental health, and on mental health inequality. We recognize that in this storm, if you like, we've all been in the same winds and rains, but we've not all been in the same boat. So how can research help us to understand that impact and inequity of impact so we can get our services right to treat that? Our next thematic focus, which starts next year, is entitled Gone Too Soon. And this looks at stopping the tragic early death of those in mental distress and in with mental illness. To put it into perspective, the suicide rates in the UK had been increasing for a decade in children and young people before the pandemic struck. Now, during the pandemic, we know that death by suicide had stayed and actually taken a little dip in the UK, but there are serious concerns that that increase over 10 years is going to see continued increase. And we also know that those with serious mental illness die 15 to 20 years earlier than their mentally healthy counterparts, and there's so little research in that space. So in Q1 next year, we launched this new thematic focus. And we've got our eyes on the prize for the future. 2024, we want to really start tackling depression and taking the treatments, the radical treatments that are out there, out of the shadows and into intervention. There's a whole body of work being done by great research organizations on this already. And by 2024, we want to be in a position to trial and invest in radical new alternatives to depression. To put it in context again, there are really only 2 types of treatments at the minute that are prescribed for depression. One is talking therapies, counseling, etc., and the other is antidepressants, but those combined only work for 50% of those diagnosed with depression. And we know that the World Health Organization tells us by 2030, depression will be the biggest global burden of disease. So this is something we've got to tackle, and we've slated to make our efforts building on other people's research from 2024. So in 2020, we launched a call for new fellows, and at the start of this year, we were able to announce 3 new MQ fellowships. These are hugely important investments for 2 reasons. One, they invest in really high-class science, and in this case, in children and young people's mental health, looking at the impact of the pandemic on children and young people, looking at how we can tackle borderline personality disorder through a new community-based approach, and one looking at the links between transition points in adulthood in children with autism and their mental health. So really top-class science, but what's equally as important with this fellows program is there are nowhere near enough high-quality researchers in the mental health space. They get to a point in their career and are attracted away to other places where investment is great, and mental health is lagging behind. So these investments are hugely important, and I'm really excited that Dr. Young, Dr. Gujrani, and Dr. Taylor are 3 fellows that we've been able to invest in. And we know from our 8 years of fellows programs and over £5 million of investment that for every pound we put into one of these fellows, they go on to secure another £5 in investment research. So a really exciting program this year. The other area that we're investing into is the COVID clinical neuroscience study. So this is looking at a very different version of contracting COVID from the FOSS program. So this is investigating the direct impact on the brain, the neurological impacts. And so there's a little talked about condition called encephalitis, which is essentially this reaction by the brain, this swelling that happens. That has got similarities to a stroke, essentially. And we've seen it in the news reported, and we are supporting a study that is looking specifically at the COVID links to that, both so that we can learn how to prevent and treat that within COVID, but also how we can learn more about managing neurology conditions in the future. So a really exciting multidisciplinary project that has launched last year and will go on for the next 18 months. DataMind is another really exciting project. So we invested a few years back in a project called the Adolescent Data Platform, which in Wales pulled together what we refer to as regularly collected data. So let me just break that down for a second. Every time you go to the GP, or you attend school, or you go through the judiciary system or the national insurance system or whatever, there is data being collected there. And by pulling all that data together into one place, we can build a better picture of understanding the mental health of the country. So having achieved that in Wales, we received, as part of a wide group of about 16 different universities alongside MQ, an investment from the UK government to create the first UK-wide data hub. Now, what this will do is accelerate the speed at which we can carry out research studies. So instead of research having to go out and find loads of people to get involved in their studies, we can improve diagnosis, treatment, and policy decisions by operating in real time from data. And the other thing this does is, during the pandemic, if there's one thing that we desperately needed more than anything, it was real-time information. And so from a mental health perspective, instead of what I like to call the weaponization of mental health that we've seen by many a politician and many a commentator, this decision is for people's mental health. I doubt it. We're able to take live real-time data to help inform those decisions on the way through. So a really exciting project that we're partnered with there. So that really, if I'm speaking business talk, if you like, that's all outputs. That's all stuff we did or stuff we're doing. To you that have funded it, to you that supported it and shouted about it, what impact has it genuinely had? Because the mental health crisis has been going on for a decade already. We've got to start making some ground. So this is the difference that your support is making. In 2021, we ran the MQ Science Summit, and MQ is uniquely positioned to pull together all top minds in the world to get them to try and move this forward and to drive an agenda. So we brought together experts from different disciplines around the world, with over 300 people attending virtually, as everything was, including over 80 researchers from the global south. And there's a great growing need for us to engage in understanding what's happening with mental health in the global south, and how we can learn from researchers in those spaces as well, their voices that haven't been heard. And so by increasing the diversity of conversation, by bringing together all these people and expertise and breaking down the silos, we are seeing those conversations move forward already. The other impact that we had last year was working with the all-party parliamentary group who had a specific focus on a fit and healthy childhood. And they were really interested in understanding the impact the pandemic's had on children and young people in this country. And so in the UK, we partnered with them and pulled together a report with over 40 academics and charities. And there were some really key things we called for in that report to Parliament. So one was more funding and better support for children and families, given the impact of the pandemic. One was more resources for schools to better support the mental health of students, recognizing that in just the first year of the pandemic, diagnosable mental health conditions in children and young people had gone up from 1 in 9 to 1 in 7 in just 12 months. And thirdly, we asked for more funding for research and better access to existing data. Just like I was saying with that data mine project, we need faster access to data, and we need to be able to fund research more quickly to move it forward. We've seen the impact that good investment, fast investment, focused investment can make in research in the way that the jabs have changed our ability to cope with COVID, and the medicines that we've got out there, we haven't got the same for mental health yet. So that's what we were calling for. So what did that achieve? Well, we saw a £9.5 million investment to train senior mental health staff in schools, over nearly 8,000 schools across England and Wales. It's a great first step by the UK government. We also saw a £7 million wellbeing for education programme to provide training to resource more staff who are working with young people. And thirdly, we saw a Department for Education funded link programme designed to improve partnerships between health and education leaders. Now, it's hard to say that 9.5 million, 7 million and another programme isn't great. It is a great first step, but let me emphasise that first step a bit. The job is nowhere near done. If every politician that used the phrase mental health in Westminster was trying to write a cheque for their area behind that, that number doesn't add up nearly close. So there's way more for us to do, but that's a fantastic first moment and move forward. So there's more that we're going to continue to do in this space to advocate and push forward, and we need your help to do that. So the first thing that we've done is we launched a paper called Fit for Purpose, which specifically looked at that tackling inequalities in mental health agenda. So where are the gaps? We know, for example, that Black women are essentially invisible in all of mental health research because they're not being recruited, they're not being brought into studies. So there's actually a whole section of the population we know very little about their mental health, and that's partly what this paper pushed for and is pushing for. We also produced new research priorities along with the Academy of Medical Sciences and all of the other research funders together. And that process was led by Professor Chris Whitty, who had the honour of attending one of the events that we ran, who helped to talk about where the mental health impact really was during the pandemic. And I can share, as much as the Chief Medical Officer and his entire team are absolutely battling COVID day to day, they recognise the impact on everything else, and mental health is high up the agenda there. So it's really great to see that focus from that department of government. And finally, thank you to all of you. We actually were able to send over 2,000 letters to Parliament this year calling for more funding for research. And that is something that, you have mobilised to do and you have made the impact for. And so we will continue to follow those up and use those to build the credibility of MQ and to build the pressure on government to do more for the mental health of this nation. One of the fellows that I mentioned in the fellows program earlier, one of our earliest fellows was this fantastic individual here, Professor Ethel Mpungu, and she ran a research project looking at the links between mental health and HIV across Africa. And really exciting, last year she was actually elected to be one of the BBC's top 100 most influential women of the year, and her work continues to impact mental health. And we could have lost Dr. Ethel to any other field of research because she's ridiculously talented, but she's retained within mental health and she's driving forward goals. And this is a great example of that learning from the global south. How can we understand how her community-based projects are transforming the lives of those with depression and HIV and roll that out here in the UK? So looking ahead, what does the future hold for MQ? As I said, we're in it for the long term. We've been here for 8 years already, and We're in the foothills of the Himalayas of our understanding in terms of mental health, but we believe that we can climb that hill. So we've set ourselves 4 bold sort of ambitions moving forward. Firstly, as I say, next year we launch our new thematic focus of Gone Too Soon, really trying to tackle this understanding of early death. How do we stop death by suicide rates continue to increase? How do we push back that tide? How do we stop people with serious mental illness dying 15 to 20 years earlier than their mentally healthy counterparts? And so we launch that next year, and we'll be investing over £1 million into new research into that space. We're also looking to increase our advocacy for the UK, to the UK government and worldwide. We launched a US office about 18 months ago, and are working more and more to look at how we can have an impact globally in that. And we are hoping to announce some additional research into low-income countries next year as well. Thirdly, we want to put research to work for the people. I have absolutely no doubt that the public has learned the impact of science and research this year in a way that we've never seen it before because of COVID and the vaccines. But there's absolutely no point in mental health for research to be done and put on dusty shelves and sitting in universities. What we want is for it to be put to work. And so we are committed to continuing to find those impacts, find those ways that treatment can come into action, just like I've shared with you this year. And finally, we want to continue to break down the barriers to good mental health. Now, what do I mean by that? I mean, we want to break down the stigmas that stop people talking about their mental health and mental illness. We want to be able to find mentally healthy workplaces and encourage companies to take a data-driven approach to mental health, to really care about their people, but be informed as to what genuinely works. And we want to continue to get people just like you to engage both by being part of research, but also advocating and funding new research and helping to see us find this brighter future that we all believe in. Thank you so much for your continued support. Without research, it really is just guesswork, and it's far too important a cause for us to continue taking a guess at.
Thanks, Lee. It's so interesting to hear what you're talking about. So now it's actually the time for us to put you on the spot and for us to ask you some questions. So just a reminder for the people on the call, if you would like to ask Lee some questions, then please do put them in the Q&A box underneath at the bottom. We have had some questions submitted in advance because there are a number of people who couldn't make it today, unfortunately. Just a reminder, we are going to make the recording of this session available to watch again. So Lee, I have the list of some of the questions which have been submitted to us in advance here for you. And the first lot of questions actually are all on the same theme. Lots of people asked this, variations of the same question, which were, how do you decide what research to invest in? How do you choose where the money goes? How do you decide what research to fund? How do you choose the researchers you work with? So could you talk us through the process?
Yeah, it's a smart question. It's an investor's question. If I'm putting money into this thing, how do you decide where it goes? It's a very good question. So we believe in investing in best-in-class research. We don't want to waste a single penny of the money that we get. And so we have a mental health sciences council that is made up of some of the top researchers across the world. And those individuals meet together to review and to plan our research agenda. And so we will use that group of experts to pull together a sense of what it is we want to invest into. So Gone Too Soon, thriving in a post-pandemic world, etc. And we will put out a call to say, here's what we're interested in trying to discover, and here's what we want to invest into. And then we will accept applications from all over the world, from the brightest researchers with the best research questions. And that council's job is to then distill through that to say, these are the particular projects that we need to invest in. And so some of the ones I've listed there, the Idea Flame project, Ethel's project in Africa, those were projects that went through that whole process and have borne fruit and got us to that impact. And so we're made up of this really multidisciplinary group that, MQ looks at mental health with a mind, body, brain perspective, like a whole person perspective, and recognizes all the social impacts of that. And so we have people from psychology, psychiatry, neurology, with clinical experience, those who've suffered from mental illness themselves, all coming together to battle that out, if you like. So it's that Mental Health Sciences Council that we answer to, that makes sure that our research is top class, done by top class people, and ultimately drives towards impact.
Great, thanks for explaining the process. So I've got another group of questions which are all very similar, which I've put together, and they're all variations of what do you think has been the biggest achievement of the last 12 months?
Wow. So I think, if I zoom right out, I think the world today, compared to 12, even 24 months ago, recognizes the fragility of its own health and mental health more than ever before. And so we've seen our healthcare systems put to absolute stretch and limit. We've absolutely and rightly honed in and focused in on COVID and vaccines and stopping what was, the biggest public health crisis for multiple generations, for 100 years. Spanish flu is the last time I can remember this. And in the midst of that, mental health could have just vanished. It could have just been completely wiped out as a concept. But instead, I think people are more aware now of their own mental health, of the mental well-being of their friends, of their family, are speaking about their mental health more than ever before, are passionate about investing into research to solve this thing more. And I think the thing that we should be most proud of is coming out of the pandemic, 5, 6, 7, 8 years from now, whatever endemic version of COVID world looks like, I think we should look back at this sort of watershed moment when mental health, after years of effort and years of people speaking out, is hopefully now in a place where it can accelerate its understanding of mental health. So yeah, that'd be what I think we should look back at this point and recognize more than anything else.
It sounds like something that the whole of the mental health sort of workplace can be proud of for that then. Yeah,
and it's no one organization, it's no one individual either. You've got, for years you've had hundreds and hundreds of celebrities, one after the other, starting to talk about the mental health, high profile individuals using their platform. And you've also had tens of thousands of individuals, at work with their families, breaking down those barriers themselves in their own communities, in their own places, to talk about their mental health and be brave and share about that. So, it's been a huge way of growing. And I think the pandemic has pushed that along. As I said before, I think conversely, we need to be really mindful of the weaponization of mental health and the language that we use around it, where we justify things because of people's mental health. And I think there's risk there. But
well, that leads me quite nicely on actually to another question we've had through, which is what has the impact of the pandemic been on MQ's research?
In terms of MQ's research, we, as a lot of charities have seen, at a time when we need to be more than ever before, there has been real pressure and real strain, and that can't be ignored. Equally, we're in a fairly unique position, I would say, that we've been able to use that momentum I spoke about earlier to garner more people's support to invest harder and faster into research. So we have had some research projects that had to be put on hold because literally their labs have been shut down and they can't go into them, and they're working from home and they don't have the equipment. So there have been elements of that we've had to manage. But I would say counter to that, we've seen more passion, more investment, more people demanding answers to the challenges of mental health. So I think it's been a mixed bag for us, but I think ultimately in the long run, we will see considerable growth in that.
And on a practical level, have any of the research studies that MQ supports been paused because of the pandemic?
Yeah. So as I say, there's a couple that have been because labs have been shut. I mean, some of the labs that were being used for mental health research literally got turned into vaccine testing centres,
Wow.
as in testing the vaccine out centres.
Right.
So yes, we've definitely seen that, but not on a scale that has stopped our progress, but it has been the case.
So with that leads me on to another question which someone has submitted, which is how do you think that we should balance the need between funding for mental health services and the funding for mental health research?
Yeah, so if we look at, I mean, for me, this is a question of effectiveness and efficiency. So let's take depression as the example I used earlier. 50% of all the things we've got, it works for only 50% of the people diagnosed. So you can invest all the money you want on increasing those services to treat depression. And it's not the case that everyone who needs access to them is getting it quick enough. So that's fair. But even if you scale it, it will still only work for 50% of those diagnosed. So you've got to look at where can there be other interventions, new interventions, more efficient, effective interventions being invested into, and research to build those up alongside an expanding of it. And it's different for different conditions, there's no denying that. But the efficiency rates of most mental health services are nowhere near high enough. So access is a problem for sure, particularly for children and young people. So, you know, that is a real pinch point where services should grow. But equally, even the effectiveness of those services aren't high enough to meet the STEM. So, you know, for me, it's a 70-30 investment. 70% of money needs to go into more research to accelerate the opportunity to invest that 30 better in the next 5 years to grow more interventions.
And to help streamline services, I imagine, as well.
Yeah, if you look at the study on PTSD that we discussed earlier on, if you've now got a brand new intervention for the NHS that has 90% effectiveness, I mean, that is a huge threshold for any treatment of any illness. Like you talk about the COVID vaccines, we're not 90s a dream, you know, 65% is like a pretty good vaccination level. So a 90% effectiveness rate on that, we roll that out, the efficiency rate goes through the roof. So it's about finding those things that can be more efficient and more effective and help those people that, you know, there's a whole cohort of people, even if you grew those services don't help them. So we can't just invest in new services.
So I know one of the slides you had mentioned about setting priorities for research, and one of the questions we've had in is, what should the biggest priorities be for mental health research? So what do you think is the most important thing that we should be researching? So
the list that I've given is from an MQ perspective, where we think we can have the biggest impact in what we're doing. There are other organizations, you know, government-funded organizations that are investing into other areas because that's where they can have impact as well. The reality is, if 75% of all mental health conditions are diagnosed under the age of 18, that's got to be where we start. And worryingly, less than 20% of all investment is in children and young people's mental health, and only 7% of investment is on new interventions on children and young people's mental health. So from my perspective, that's got to be an area that we start in, because we've got to move downstream and stop the flow. That also means that, you know, prevention has got to be something we've got to look at. Like, we can't over medicalize schools or over clinicalize schools, if you like. It's not about, you know, can we diagnose children faster to get them in the CAMS quicker? It's how do we put preventative measures in so that we don't then have to make a referral on the way through. So I would say that's the biggest single priority, and is the top priority of the UK's mental health priorities that we supported alongside the Academy of Medical Sciences.
Into preventions to stop illnesses developing, you mean?
Within children and young people specifically.
Right. Wow, there you go. So taking a left turn on some of the questions now. So this one is, what is the thing that you would say you have learnt most since becoming the CEO?
What's the thing I've learned most? So I think in my role, you're always in a position of trying to balance things out. Like, that's just the nature of the job. You've got incredible scientists with incredible ideas. You've got funders who want to fund very specific passionate things, impassioned things. You've got things that are hugely important, but that those that want to fund it don't see as important. And you've got things that somebody might want to fund that, you know, sounds great, but actually is not going to have any impact at all. So the thing I've sort of learned, I suppose, the most in the last sort of 20 months in this role is, how do you try to bring all those different voices together? And I believe the answer that I've learned is by bringing those who've experienced that specific mental ill health, bringing them to the table to mediate between scientific views and financial interest. Because, like I said earlier, there's absolutely no point in scientists running off to do stuff because it's interesting. There's absolutely no point in people who've got money to invest just throwing it where they fancy. If it's not rooted in the people that we're all trying to support, then it's a waste of time. So I think I've learned the power of putting these individuals at the very center and at the chair of the meeting. So when I say the center, they've always been the center in terms of my passion, but putting them in the chair role, you get these scientists and funders to listen and ask them questions back. Just ask them questions about why, and then share your story. And suddenly the room starts to get consensus quite quickly.
Sounds like you're talking about sort of co-production and PPIE, and putting people with lived experience at the front. Yeah,
if you want to put the sort of industry terms on it, then yeah, 100%. It's how do you do those things? How do you have public and patient involvement, engagement, etc. But, you know, for me, it is the passion of an individual's story and the desire for them to see change can harness scientific knowledge and financial acumen in a way that nothing else can.
There you go. So another question, again for you, and along a similar vein, is what has been your highlight of the last year?
My kids go back to school. I mean that in all sincerity. I have a 7 and 5-year-old. I talked about, you know, the pandemic in its early days. People talked about like home education. I was all about home entertainment. How do you entertain a 5 and 7-year-old and continue to do your job? And how do you survive by just entertaining? So schools reopening was a big deal, I'll be honest. But I genuinely think, you know, it's part of my own experience and journey in terms of where my balance of mental well-being sat, and also how you get that for your kids as well. So outside of everything else, my kids being at school for their sake and for mine is 100% the highlight of this year.
There you go. That's a personal highlight. So what would you say has been the MQ highlight of the last year then?
My kids going back to school. My kids not appearing on Zoom calls every 2 minutes to try and interfere. The all-party parliamentary group was a great one. Literally, my kid just got up and put his face right in the microphone and stared down his own throat while I had my back turned while I was picking something off the floor. So, no, MQ highlights. I mean, there's, you know, some of them are on the slides in terms of the things that we discovered. I think I mentioned a meeting earlier where Professor Chris Whitty was in the meeting. To have Professor Whitty in the middle of the pandemic turn up to the mental health expert meeting that we pulled together of over 40 or 50 experts and share his personal take on, and professional take on where mental health was, and hear from him directly. That was a big deal. And to hear him, you know, talk about the fact that right now it feels like COVID is number 1 and everything else is number 2 after that. But that he was able to call out mental health as you know, being something that is in his mind on every decision he's trying to make on the way through. And hearing from him directly, you know, what we'd already seen in the data and on the ground was that, for example, eating disorder referrals have gone through the roof and things like that. Hearing that directly from the CMO and knowing that, you know, you've got it right, you're on track, and you're also being listened to. Like, I think that for all the other impacts, you know, the money that government have invested, the research findings we've got, knowing that at the very heart of the UK government is somebody that is passionate about mental health as well, gives you confidence that everything you're doing can then create more impact.
Yeah. So that's sort of the positive of the last year. What would you say has been the biggest challenge over the last year for MQ?
Those times my kids weren't at school. Biggest challenge. you know, as a research focused organization, there was a period where, you know, a lot of people were very focused on immediate response, and rightly so, to the pandemic. But that did bring challenge for research organizations, and we were one of them, where, you know, in the immediacy of making sure that people were all right today, there's a risk that we lose ground on the fight we're having over the next decade. So that was a live challenge to us. And we were really supportive of making sure that those, you know, emergency responses were right. You know, we pivoted our PTSD study from one area to another. We supported our researchers and scientists who were caregivers to make sure that their funding was, you know, continued to flow, but we managed their workload so that, you know, we could get all that right. And now we're at the other side of it. We're in a position where, you know, we've invested last year into research more than we have done in the last 2 years. So I think we've turned the tide of that, but it was a genuine challenge that research could, like, if it didn't pivot back to research quickly, we could have lost a decade. So that was a real genuine fear, but we've weathered that.
You sort of mentioned a little bit that you think the general public, because of the vaccines discussions and things like that, they have a sort of a better understanding of research and the science. Do you think that that will help MQ moving forward?
Yeah, I mean, if we look pre-pandemic, there was a genuine societal narrative that started to go against the expert. Like for the desire for balanced conversation, we were almost throwing science out the window at times 5-6 years ago. And I genuinely think for the vast majority of the country, it's been one positive has been, it's been a reminder of the impact that science and research can have on our day-to-day lives and how it can help us through some of the biggest challenges we've got. And I think there's a vocal minority that we hear from that, you know, don't believe that and whatever, but I think for the vast majority it is the case. And I think that, you know, in that same time, there's been high-profile individuals who shared about their mental health as well directly, and people who've been happy to share their stories. So I do think the case for research is being made through the vaccine for all research in a way that it hasn't publicly had that conversation before.
Yeah. So going back to the questions that have been submitted then, where do you see MQ in 5 years' time? That's like an interview question. It's like you're applying for a job for MQ.
I always, I did interview somebody once and I asked them, you know, where would you see yourself in 5 years? And they were like, hopefully in this job still. And I was like, yeah, that's a fair answer. MQ in 5 years, I mean, like I say, and it's not my line, it's the line of our chairman, Dr. Malik. We're in the foothills of the Himalayas in many ways in terms of our understanding of mental health and what we can do. So 5 years from now, I want to see MQ investing, you know, 500 or 600% more than we are per year today in high class, like world class research. Because if mental health's been in decline for a decade, and it's declined at a faster rate, we believe, from early research over the last 2 years, the job has just got harder. So we need to redouble our efforts and redouble them again. The first double is to hold our ground, and the second double is to move faster and ahead. So that would be one. The second one is, you know, today, 8 years in, we've invested £22 million into research. Some of that has already started turning into interventions, as we've discussed, but a lot more of that, you know, comes to its conclusions in the next 2-3 years. So 5 years from now, I want to see that investment really turning into brand new interventions in communities. So I think those would be the two big things 5 years from now I'd love to see from MQ. And, you know, in a world where the stigma continues to get broken down and more investment comes from government and more people recognize mental ill health as being something we've got to take seriously, there's lots of little extra caveats I want to see in there, but I believe MQ will be at the heart of a lot of that 5 years from now.
Right. Well, Lee, that has exhausted all of the questions which we've received so far. So before we draw it to a slightly early close, is there anything else that you wanted to say at all?
I think the main thing is, you know, everything that MQ exists to do is to bring together the brightest minds, bring together those people who are struggling with mental health, and to find solutions and answers. And those are two of the heroes in that equation. You know, the guys doing the research, the individuals who are struggling with their own mental health. But the third hero in all of that are the individuals, you know, who are listening today, who are funding that research. And it's when we, you know, MQ's job is to just sit in the middle and get those high quality researchers, the lived experience, and get those people giving together to make that work. So a huge thank you for being 1/3 of the group of heroes that has got us to where we are.
Heroes indeed, absolutely. So that brings us to a close. So you get 15 minutes of your evening back, Lee. Go and see what your kids are doing.
No. I'm going to put a pasta bake in the oven, read the Gruffalo twice probably, and then hopefully it's just me and a pasta.
All right, well, I want to echo Lee's thanks and just say thank you so much to everyone, not just for joining us this evening, but also for your continued support of MQ. We really couldn't do what we do without you and without your support. So thank you very much. And with that, I will bid you all adieu. Thank you very much. Good evening.
Good evening.